Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes. Geriatric care can play a vital role in helping older adults live healthier, safer, more independent lives. And at Valley Health, we focus on caring for the unique medical needs of aging adults, managing their chronic conditions, and supporting cognitive and functional health. And today we're talking with Valley Health's Section Chief of Geriatrics, Dr. Cynthia Pinson, about geriatric services at Valley Health. Thanks so much for being here.
Oh, thank you for inviting me.
It's such a great topic and a huge percentage of our population in need of geriatric care. So what's the difference between geriatric care and primary care that we've kind of grown up with?
Well, primary care is more of all ages, all the way from infant to older adults, anywhere in between. Geriatric care is a specialty care. It's focused on people aging 65 and above, and some people that may be a little bit younger but has so many medical problems that they can qualify. So it's a subspecialty.
Okay, and a lot of people are in need of this. What kind of health issues are commonly addressed in geriatric care specifically?
The big ones are diabetes, heart disease, high blood pressure, cholesterol problems, strokes, dementia, Parkinson's. There are numerous number of common illnesses that are addressed in geriatrics.
Yeah, there's such a large percentage of people. All the things that you can get when you get older is what a geriatrician can kind of. You address that it's 65 and older, but again, younger people can take part for specific reasons.
That's correct. Really, when you turn 50, you get that letter from AARP, Dear Senior. So you basically can come to see us because you're a senior, and it's time to think about your wellness, preparing for when you're older, because sometimes the diseases kind of creep up around that age group. And there are preventive care that we can help you to do. So when you age into the 65 and older, you don't necessarily have all of those illnesses, and you can be a healthier person.
Yeah, be a little bit more proactive.
That's right.
With that. And taking care of older adults is different than taking care of young adults. Can you talk about that a little bit?
Older adults really have different physiology. We're talking in general terms. When we age, the organ system start acting differently. So you have to understand that in order to take care of a person that's older. And also older people just has more diagnosis added to them and more medications. So in all, they're just a complex individual. And sometimes older people need help from families to make decisions or to take them places. So a lot of things affects their health and how they're able to care for themselves.
You mentioned memory care, and that's a big concern for a lot of families. How can Valley Health support that?
At Valley Health, we want to be a place where if there is a friend that says, Dad's having these little memory things, I went to pick him up for the market and he completely forgot he was still in pajamas. This has been happening. When someone says that to you, you could just say, call Valley Health. They have a service where they can help you assess this type of situations to kind of figure out what could be the underlying cause. And is it a reversible cause? They can be tested, put through assessments to come up with a reason why Dad is acting like that. That's very important. If you can detect some of these things earlier, it helps the family to make decisions. And later on, if there are symptoms with memory, such as dementia or Alzheimer's, we can help managing that. There are medications out there, newer treatments out now. And there are a lot of behaviors that needs to be managed, emotional health, and the family also needs support.
You also mentioned helping with chronic diseases like COPD and diabetes. How can geriatric services help with that?
We look at the person as a whole person instead of the individual disease, because all the diseases actually affect each other. And then the medications that you take for them, if you need to take them, also interact with each other. So as a geriatrician, we understand the body, the aging body, and what effect the medication has on them and what effect other diseases has on the aging process. So we can help managing all of that and pointing out two things that the patient or the family may not even know at the time or notice, and warn them of signs that they can be monitoring for and report back to us. So overall, it's a process to help managing the chronic illnesses and how they interact with each other, and help the person age with dignity, and live as long as they can in a healthy state.
We take our babies to pediatricians, right? So we want somebody who's specifically attuned to older adults, geriatric services. for our older family members too.
Yes.
It's important to have that
Yes.
distinction. Dr. Pinson, thank you so much for joining us today.
Thank you.
Thanks for checking in on Monday Health Minutes.